Craig is recognized for 5 minutes.
Thank you so much. I want to take just a moment for a moment of personal privilege as well to welcome Farm Aid to Minnesota on Saturday. So we're looking forward to that, every single one of us in Minnesota. I have a few questions today, so I'm going to get right to it. As I mentioned in my opening statement, I remain increasingly concerned with healthcare access in our country, and of course, especially in rural America. In the state of Minnesota, just a couple of weeks ago, we're seeing health clinics and hospitals start to close. 6 southeast Minnesota clinics are closing by the end of the year due to rising cost and staffing shortages. These local clinics are the very institutions serving our nation's farmers who work stressful, high-risk jobs to feed and fuel our nation. There are estimates that the Republican reconciliation package will close hundreds of rural hospitals, approximately 700, in fact, across the country. Can anyone on the panel tell me a little bit more about USDA rural development programs that my constituents can look to in order to reinstitute and improve upon rural health care access? Representative Torres-Small?
Thanks so much, Ranking Member Craig. When I think about hospitals across rural America, there was COVID-era funding that was fundamental to saving hospitals. They provided direct assistance to lending that saved rural hospitals from closing their doors. Also, when you look at community facilities, that's something that rural hospitals rely on to be able to expand and provide services that are needed, but also I visited one hospital in North Dakota that opened their doors to then rent out space for others, and that helped them pay back the loan. The problem is that most of community facilities funding is loans, and especially as hospitals face the dire impacts of Medicaid cuts, they're not going to have the resources for those loans.
Thank you very much. Commissioner Heimel, I know in your testimony you actually said rural health care in your region is approaching a full-blown crisis. Can you just elaborate on that?
I'd be happy to. I'll give you an anecdote. We have a UPMC hospital that serves Potter and surrounding counties. Recently, for various factors, they had to close maternity services there, childbirthing services. We now have a 7-county maternity desert in north central Pennsylvania. There's not one facility within the 7 counties that can provide the birthing services and maternity care. That's a concern. That same hospital very recently announced it's going to close its long-term care, its nursing home. And the residents there are going to move to another facility. People are quick to say, oh, that's a pattern. It's going to be the dominoes falling, and next thing you know, we won't have a hospital. I'm not trying to go there. I'm trying to point out that the investment in rural health care is extremely important. Down the road, 90 miles from our county, through the Community Facilities Program, a significant grant came to Jefferson County in Punxsutawney from the old Groundhog Day community. They were able to basically save their hospital there through the Community Facilities Program. They renovated a building into 2 different units and were able to put a new emergency department in that hospital through this program. So it's a deep concern, a very, very high priority in our region, and I'm sure other places.
Thank you so much, Commissioner. And I'm going to go back to Representative Torres-Small. I mean, this has been a really rough 9 months in rural communities with high input costs, low commodities prices, with trade wars, Medicaid cuts, SNAP cuts. There's been a lot, and my family farmers and others are telling me that this is devastating. How would you describe the impact? What are you seeing that this administration's policies have had or will have on rural communities?
Thank you for your attention to rural communities in the wake of these impacts, Ranking Member Craig, because it's going to be significant. Whether that's the $155 billion of lost spending to rural hospitals because of the cuts to Medicaid, or whether it's families that are facing a double whammy of SNAP cuts on top of an uncertain economy, or if it's stranded soybeans in the Midwest because of the tariff war, the collateral damage of that. we're facing real uncertainty in rural America, and that's why your attention is so crucial to make sure that this committee works together to support rural America.
Thank you so much. And Mr. Chairman, I yield back.